You're someone who likes to be in the know, right? Especially when it comes to something, well, as crucial as your health and the healthcare system.
Absolutely.
But let's be honest, trying to keep up with it all, it can feel overwhelming.
It really can.
That's where we come in. Today on The Deep Dive, we're tackling a vital aspect of healthcare that often happens, behind the scenes. How hospitals actually work to ensure the quality and safety of the care you receive.
Exactly. High-quality, safe patient care isn't just luck. It's the result of dedicated systems and continuous effort.
Right.
And to get a handle on this, we've pulled together information from several key areas. We'll be looking at the influence of global organizations like Joint Commission International or JCI.
JCI, okay.
And national ones such as NABH, that's the National Accreditation Board for Hospitals and Healthcare Providers.
Got it.
We also have insights from the Institute of Medicine on how we even define and measure what quality actually means in this context.
That sounds fundamental.
It is. Plus some practical guidance on running effective committees. That comes from Health Leaders Media and MGMA, the Medical Group Management Association.
Right, and we're also diving into different methods for improving quality, thanks to the Public Health Accreditation Board.
Yes, those methodologies.
And the important role of hospital board quality committees.
Yeah.
We've got a white paper from Alameda Health System and some expert perspectives on that, and even a real-world look at the terms of reference for a safety and quality committee at the University Health Network, or UHN.
A practical example, yeah.
Think of it visually. Healthcare professionals collaborating around a table, business minds in meetings.
That collaboration piece is huge.
And graphics maybe showing interconnected systems.
Right.
It all points to the teamwork and, honestly, the complexity involved.
It's definitely complex. So for you, the listener, our goal today is pretty clear. We want to break down the key strategies and organizational structures healthcare organizations use to boost quality and protect patients. Ultimately, having this knowledge should give you a clear picture of what's happening behind the curtains, so to speak, and what it means for the care you and your family might experience.
Okay, let's unpack this then.
Yeah.
When we talk about something as big as healthcare quality, where do we even start to get a handle on it?
Well, a logical first step is understanding the basic definition. What are we aiming for?
Right.
Back in 1990, the Institute of Medicine, the IOM, they provided a really influential definition.
Oh, yeah?
They defined quality of care as the degree to which health services for individuals and populations increase the likelihood of desired health outcomes and are consistent with current professional knowledge.
Desired health outcomes and current professional knowledge, those seem key.
They really are. It emphasizes achieving positive results for patients, the outcomes part, and making sure care is based on the most up-to-date evidence, the knowledge part.
So it's not just about, good intentions. It's about actually seeing improvement in people's health and making sure doctors are using the latest research and techniques.
Precisely. And the IOM also made another critical point. Quality isn't something that just, happens.
Right.
It's something that can and must be measured, monitored, and actively worked on to improve.
Okay, so measure, monitor, improve.
Yep. And to do that effectively, we need ways to actually assess it. The IOM outlines 3 main types of quality measures. First, there are structural measures.
Structural.
Yeah, these look at the resources and capabilities a healthcare organization has. Things like, is the hospital accredited? What are the qualifications of the doctors and nurses? The technology they have available? That sort of thing.
Makes sense, like knowing if a hospital has a certain stamp of approval or if the staff have the right credentials.
Exactly. Then we have process measures.
Okay.
These look at how care is actually delivered. Things like, how quickly is a diagnosis made? Do patients receive recommended treatments? How well do different parts of the healthcare team coordinate?
So, did the patient get the necessary tests done quickly? Were the nurses responsive? That kind of thing.
Exactly that. And finally, there are outcome measures.
The results.
The results, yes. As the name suggests, they focus on the results of the care. Examples would be things like mortality rates after a certain procedure adjusted for how sick the patient was to begin with, of course.
That's important.
Or rates of infection after surgery, or even how satisfied patients are with their overall experience.
So did the patient actually get better? Were there complications? How did they feel about the care they got?
All of those fall under outcome measures. Now, when we talk about organizations that really champion these principles, Joint Commission International, JCI, is a major player.
Yes, JCI.
They're recognized around the world as a leader in pushing for high healthcare quality and patient safety. They've accredited, get this, over 1,000 programs in more than 70 countries.
Wow, that's a huge reach.
It is, and their mission is very direct, to enable and affirm the highest standards of healthcare quality and patient safety for all.
That global perspective really highlights that this is an international drive towards standards.
Absolutely. And it's not just international. We see similar bodies operating within specific countries, too. NABH.
The one you mentioned earlier.
Yeah, the National Accreditation Board for hospitals and healthcare providers. That's a clear example at the national level, showing this focus on quality and safety is a priority in many different healthcare systems.
Okay, so we get that quality needs measuring, and there are these big organizations pushing standards. But how does this actually translate into, tangible improvements for patients inside a hospital?
That's where the role of committees becomes really crucial.
Committees, okay.
One increasingly common strategy hospitals are using is setting up dedicated board quality committees.
So part of the hospital's main governing board.
Exactly. These are essentially standing committees within the board, specifically focused on overseeing the quality and safety of patient care. And we've seen a significant increase in how often these committees are being established.
So the people right at the top are paying close attention.
They are. And a key thing to understand here is that effective quality committees focus on governance, not the day-to-day operations.
Governance versus operations.
Yeah.
What's the difference there?
Think of it like this. They're not telling doctors exactly how to perform a surgery that's operations.
Okay.
Instead, they're making sure there are clear guidelines and training in place for surgeons, and that there are systems for reviewing surgical outcomes and identifying areas for improvement. That's governance.
Got it. Setting the framework, not micromanaging the work.
Precisely. A vital part of these committees is their charter and scope. This lays out their responsibilities and ensures they're aligned with the hospital's overall quality and safety goals, and it needs the full board's approval.
So it sets the big picture expectations, make sure everyone's working towards the same goals.
Exactly right. This often involves setting annual quality and safety priorities with specific, measurable targets.
Measurable.
And whenever possible, they use national benchmarks to see how they stack up against other hospitals.
So they can compare themselves.
Yep. Interestingly, the sources point out how important it is to involve finance leaders when setting these priorities.
The money people. Why is that?
Well, to make sure they're also considering things like patient volume and the costs associated with different initiatives. It's about being strategic with resources while you're trying to improve quality.
That makes a lot of sense. You need to be smart about where you focus your efforts and, your money.
Another really important area these quality committees oversee is the credentialing process.
Credentialing, like checking doctors' qualifications.
Basically, yeah. It's how hospitals make sure doctors and other healthcare professionals are qualified and competent to provide care within their facilities. The committee often conducts regular reviews or audits of this process.
To make sure it's working properly.
Right, to ensure that everyone who has permission to practice at the hospital is adhering to the established quality and safety standards. We even saw an example from Norton Healthcare, where they explicitly state that physicians are expected to follow best practices as a condition of keeping their medical staff privileges.
Wow, so it's not just about having a medical license initially. It's about an ongoing commitment to the hospital's quality standards.
Absolutely. And finally, our sources touch on the growing importance of a patient-centered approach.
Patient-centered care.
Yes. The idea of adopting a patients-as-only customer mindset, like Park Nicollet Health Services did, really underscores the need to prioritize patient needs in all quality improvement efforts.
Patients as only customer. That's a powerful way to put it. Keeps the focus squarely on who the healthcare system is ultimately there to serve.
It does.
Okay, so these quality committees sound important, but how do you make sure they're actually effective and not just, another layer of meetings?
That's a really critical question. The makeup of the committee itself is vital.
Who's on it?
Ideally, you want board members who bring a variety of relevant expertise. People with backgrounds in quality improvement methods like Lean and Six Sigma.
We'll get to those later, I think.
We will. Also, expertise in safety protocols, data analysis, understanding the patient experience, risk management, legal issues, even finance.
A real mix.
Yes, and the white paper from Alameda Health System specifically highlights the significant value of including patient and family representatives as actual voting members.
Wow, having patients as voting members, that really seems like a genuine commitment to making care truly patient-centered.
It absolutely is. The selection of the committee chair is also key.
Who leads it?
Our sources suggest that a lay board member, someone not employed by the hospital who has experience in continuous quality improvement, is often the most effective choice.
Interesting. Not necessarily a doctor.
Right. While some physicians can be excellent chairs, having someone who can focus on the overall process and facilitate discussions without getting perhaps too deep into the clinical weeds can be really beneficial.
So more of a focus on leadership and process management skills.
Exactly. And continuous learning is essential. Board members, especially those on the quality committee, need ongoing training on quality and safety metrics.
They need to understand the data.
Definitely. We saw examples from Spectrum Health. They hold 2-day retreats just focused on quality and safety for all board members.
2 days.
Yeah. And Mainline Health System, they have interactive safety fairs to educate their board.
It sounds like a real investment in making sure everyone at the top understands these critical issues.
Yeah.
What about the meetings themselves? How do you keep them focused, productive?
Effective meeting practices are vital. This includes having clear, standard agendas, using consistent reporting format.
Standard format.
Yeah, Johns Hopkins Medicine, for example, uses something called an MD&A, or Management Discussion and Analysis format for their reports. It provides structure. And actively encouraging open and honest discussion is crucial. Plus, dedicating a significant portion of the full board meetings, the sources suggest ideally 25% or more, just to discussing quality and safety signals how important it is.
A quarter of the meeting time just on quality and safety. That shows it's not just a side topic.
Precisely. Some organizations, like Johns Hopkins again, even use performance subcommittees.
Subcommittees.
Yeah, they dig into the data before the main meeting, allowing for more focused and efficient discussions when the full quality committee gets together.
So they do the homework first.
Kind of, yeah.
Yeah.
And our sources provided examples of these committees actively stepping in when they identify issues, like closely monitoring emergency department wait times, or driving initiatives to reduce hospital-acquired infections like bloodstream infections.
So they're not just reviewing numbers passively, they're actually taking action to drive improvements.
Exactly. Now, moving beyond this oversight function, there are also specific structured approaches hospitals use to actively improve care quality. It's not just about general awareness. There are well-defined methodologies.
Okay.
The Public Health Accreditation Board gave us a really useful overview of some of these.
All right, so what kind of specific methods are we talking about here?
Well, a foundational concept that underpins many of these is the PDSA cycle.
PDSA.
Plan, Do, Study, Act. It's a basic framework for testing and implementing changes. Think of it like a mini experiment cycle.
Okay.
You plan a small change. You try it out. Do you see what happened? And analyze the results of the study. And then you decide what to do next based on what you learned, the act.
Plan, do, study, act. Got it.
But there are more specific methodologies built on this idea. For example, there's Kaizen.
Kaizen. Heard of that.
It focuses on making small, incremental improvements over time by involving all employees. Often uses short, intensive events or blitzes to implement changes quickly.
So lots of small, rapid improvements driven by the people doing the actual work every day.
Yes, that's the core idea. Then there's Lean.
Lean, okay.
Lean is all about maximizing value for the patient by eliminating waste and streamlining processes.
Cutting out the unnecessary stuff.
Exactly. A key tool in Lean is the A3 process, which is basically a more detailed and structured way of using that PDSA cycle we just talked about.
Getting rid of unnecessary steps, making things more efficient. I can see how that would improve quality and probably the patient experience too.
Absolutely. Then you have Six Sigma.
Six Sigma. Sounds technical.
It takes a more statistical approach, focuses on reducing defects and inconsistencies or variability in a process. It uses a framework called DMAIC.
DMAIC.
Define, measure, analyze, improve, and control.
Define, measure, analyze, improve, control. Okay. So really focused on minimizing errors, making sure processes are super consistent.
Exactly. And finally, there's Lean Six Sigma.
Combining them.
As the name suggests, yeah. It combines Lean and Six Sigma principles to try and get both greater speed and efficiency while also reducing variation and defects.
Best of both worlds, maybe.
That's the idea. What's important to remember is that all these methods, Kaizen, Lean Six Sigma, they all emphasize improving processes, making decisions based on data involving employees at all levels, and fostering this culture of continuous improvement.
It sounds like hospitals have a whole toolbox of different approaches they can pull out, depending on the specific problem they're trying to fix.
That's a good way to put it.
Now, something else popped up in the sources, Robert's Rules of Order. Where does that fit into healthcare quality? It sounds more like something you'd use in, I don't know, a government meeting or a club.
You're right, it is about parliamentary procedure. But it plays a surprisingly important role in making sure these crucial discussions and decisions around quality and safety happen in a, well, orderly and effective way.
Orderly meetings.
Yeah. Robert's Rules provides a common framework for running meetings. It ensures the majority can make decisions while still allowing minority viewpoints and all voices, really, to be heard.
So it's about making sure everyone gets a fair chance to speak and decisions are made transparently.
Precisely. It covers the basics, how to propose actions making motions.
I move that.
Right. How to show support seconding motions, how to discuss them debate, how to make a decision voting, and even how to suggest changes to a proposal amending motions.
Okay, the standard stuff.
Yeah. It also outlines specific points you can raise during a meeting, like a point of order if you think a rule is being broken, or a point of information to ask a clarifying question, or even a point of personal privilege, maybe, to address a comfort issue or correct something someone said about you. The cheat sheets we looked at are handy for this.
So it might not sound like the most exciting part of improving healthcare, but it provides that necessary structure for effective group decision-making.
Exactly. And good board chairs use these rules effectively to keep meetings focused, encourage positive, constructive proposals, and make sure the discussion stays respectful.
Okay, so we've looked at the big principles, the committees, the improvement methods, even how to run the meetings. Let's try and tie this all together with that real-world example you mentioned, the University Health Network, UHN. What does their Safety and Quality Committee actually do?
Right, the UHN example. Their terms of reference offer a really clear picture of these principles in action. Their responsibilities are pretty broad.
Like what?
Well, they regularly review reports on safety culture surveys, basically, how safe patients and staff feel.
Okay, the perception matters.
It does. They also analyze serious incidents, what they call adverse events, and critically, they make sure the hospital has good processes in place to identify and manage potential safety risks.
Risks like?
Both in clinical care, think infection rates, bed sores, patient falls, medication errors, and also workplace safety risks for the staff.
So they're looking at safety for the patients and the people working there?
Exactly. They also oversee how staff and patients are educated about safety. They consider ethical issues that come up in patient care. And they prepare a detailed annual report for the hospital's main board, summarizing all their activities and findings.
It's comprehensive.
Their main goal, ultimately, is to continuously improve clinical care quality and the overall safety of the entire organization. They do this by trying to follow best practices and striving to become what's known as a high reliability organization.
High reliability, meaning?
An organization that operates in complex, high-risk environments but manages to consistently avoid serious errors. Think aviation or nuclear power healthcare is aiming for that level of safety.
That's a high bar. It sounds like a very active and involved committee. Who actually sits on it at UHN?
The membership is quite diverse, which is generally seen as a positive thing.
Who's included?
It includes independent trustees, people from outside the hospital who serve on the board.
Nope.
Ex officio trustees who are part of the hospital's senior leadership team.
Like the CEO?
Often, yes. Or the chief nursing officer, chief medical officer. And other voting members, plus some non-voting guests who might bring specific expertise or represent different parts of the UHN network.
So a real mix of internal leaders and external oversight.
Exactly. This collaborative approach really emphasizes the value of bringing different perspectives together when you're tackling something as critical as quality and safety.
It really does sound like a comprehensive system, from defining quality to having committees oversee it, using specific methods to improve it, and even making sure the meetings run properly. So, wrapping this up, what are the key takeaways for someone listening to this?
I think the main thing to understand is that the quality and safety of your healthcare isn't just left to chance.
Right.
It's actively measured, it's monitored, and it's continuously worked on through a whole variety of organizational structures and systematic methods.
Structures and methods.
Yeah. Dedicated committees, often at the highest level of hospital leadership, play a vital role in overseeing these efforts and holding the organization accountable.
And those external groups.
External accreditation bodies like JCI and NABH provide an important layer of independent validation and benchmarking.
Okay. And why should this matter to our listeners in their everyday lives? How is it relevant?
Well, understanding these behind-the-scenes processes can, hopefully, give you greater confidence in the healthcare system. It highlights the really significant and multifaceted efforts that go into making sure you receive safe and high-quality care. This focus on using data, on constantly looking for ways to improve, and keeping the patient at the center of it all, it ultimately aims to benefit every single person who needs medical care.
So with all of this in mind, what's one final thought you'd like to leave our listeners with? Something for them to maybe mull over.
Perhaps consider this. The next time you interact with your doctor or a nurse or any healthcare provider, or maybe if you find yourself visiting a hospital, now what kinds of questions might you now feel a bit more empowered to ask about their quality and safety initiatives? Engaging with your providers, showing your interest, it can actually further emphasize the importance of all these efforts and maybe contribute in a small way to a more informed and safer healthcare experience for everyone.